Welcome to Native Talk Arizona, Native Health's Native American Cultural Affairs program, presented by Native Health and KRDP 90.7 FM. I'm Susan Levy. Yes, October is National Domestic Violence Awareness Month, a time designated to acknowledge victims and survivors, raise awareness about domestic violence, and educate the public on recognizing signs of abuse. In the studio to tell us more today is Brooke Davis. She's our brand new Native Health Behavioral Health Case Manager for the Domestic Violence Prevention and Education Program. Brooke, I'm so excited you're at Native Health, and I can't wait to learn more about you. Welcome to Native Talk Arizona.
Yeah, it's good to be here. How are you?
Good. I'm so excited. You're so energetic, and I don't know. I'm really glad you're here. All right. So before we get started with the interview, tell us a little bit about yourself and your journey to Native Health.
Yeah, so as mentioned, my name is Brooke Davis. I use she, her pronouns. I am an enrolled member of the Navajo Nation, and I recently graduated my Master's of Public Health back in May, so I'm a recent grad.
From where?
From Northern Arizona University.
Okay, so you're a lumberjack.
I am a lumberjack.
And your undergrad was from where?
Also Northern Arizona University.
Oh my gosh, total lumberjack. All right.
Yeah, I lived there for about a good 5 years in Flagstaff, so it's nice to be back in Phoenix with all the malls and everything.
And where'd you grow up?
So I spent most of my childhood living in Fort Defiance, Arizona, like around that area. And then I moved down to Phoenix, and I went to school, like middle school and high school in Phoenix.
Okay.
Yeah.
So you're not totally new to Phoenix.
Yeah.
You were in Phoenix, and then you did high school down here?
Yes. And then I went up to college for a few years, and now I'm back home.
Okay.
Yeah.
And now you're back down here. Okay. Well, welcome back to Phoenix, and welcome to Native Health. So in terms of your career, what have you done? And I know you're domestic violence.
Yeah.
So what kind of experience, or what would you like to tell us about your background in domestic violence?
Yeah. So in my graduate program, I mostly specialize. Well, I did my Master's of Public Health and Health Promotion with a specialization in Indigenous health. And a lot of my passion in health promotion was through prevention education, community-based interventions, and really just violence prevention for tribal communities. And I think one of the most, important part of my career, I had the opportunity to work on NAU campus as the graduate service assistant for sexual assault and relationship violence. So I was the main prevention educator on campus, working with college students of all backgrounds, different levels of engagement with with college life. So working with fraternity and sorority life, athletic groups, multicultural groups, different student populations of different identities to teach healthy communication, healthy relationship, and really just domestic violence prevention and sexual assault prevention.
Did you see a lot of domestic violence and sexual assault up there?
Yeah, and so as I mentioned, most of it was prevention based, and so I had the opportunity to meet those folks, kind of guide them through, if you want to make a disclosure or do a report, help them through what that process might look like, inform them here are the people you would reach out to, and then from there kind of get them connected to other resources in the community. So I worked with Victim Witness Services of Coconino County, with Sharon Manor, and these are all local agencies based in Flagstaff that did also some really cool work with tribal communities in Northern Arizona.
That sounds kind of stressful, though, too.
Just especially,
college. I know, you've got students that are just kind of finding their way and learning, right. And then these horrible things happen. And
yeah, I will say at times it was a little stressful, but I think with college campuses, it's really unique because, I worked with students that lived on campus. They went to class every day on campus, ate on campus, everything on campus. So it was really just a set environment for folks to, just work with each other. So doing violence prevention, talking about healthy relationships, healthy communication, and again, violence prevention, I got to kind of work with them and help them identify what are the values that their community have established, and what are ways that we can change or promote health, well-being, and create a sense or a network of support on campus. So it was really unique because I was able to locate everything for them in that vicinity and find ways to get them more engaged and involved in domestic violence and sexual violence prevention.
Wow. Okay. So you have a lot of experience, and I'm assuming, and I don't want to ask anything about NAU, but I'm assuming that there's always sexual assaults and things that are going on.
Yes.
Or, yeah. Yeah. Okay. So we'll leave it at that. All right. Okay. All right. So we're going to just do like a high level overview about Native Health's Behavioral Health Department. What kind of programs do we have? I know we've got, I know we have psych and telepsych, which I know they do medication management. I know we have counseling for, I think, ages 6 and up, right?
Yes.
And then I know we have intensive outpatient programming.
Yes.
Stop. Some DUI services, and what else am I missing?
Yeah, so I think with behavioral health, we really just provide individual, group, and family counseling for challenges like stress, anxiety, grief, depression, substance use, and even like relationship difficulties. We offer talking circles, which I think are a great example of how communities can come together to, build towards collective healing, but also I guess just come together in a supportive environment to share experiences and have that peer-to-peer support for those folks. I think we also talked about like the DUI program. There's programs focused on, changing harmful behaviors that are typically court ordered. So the DUI program along with the DV offender treatment program.
Oh yeah, that's domestic violence offender treatment program. And then, I know the intensive outpatient program. And then the talking circles, I know we've got the community talking circles in Mesa on Thursday evenings with Roy Johnston. And then I know we've got the elder talking circles, which I think is the second Monday of the month, right?
Yes,
with
second
Sonetta.
Monday. Yeah.
And with Roy. And Roy comes in and does that.
Yeah.
And then I know, I can't wait to hear more. I know you've got, I saw some stuff come through today. You have some, really great stuff planned.
Yeah, I'm really excited. We're hoping, Sonetta and I have been talking about potentially beginning a youth talking circle.
That would be awesome.
Along with one for survivors, getting that back on track for DV, and a safe space for folks who identify as queer, trans, or two-spirit.
Okay, so before we get started, let's talk about the domestic violence program at Native Health.
Yeah.
So you're the new case manager and you're running the domestic violence program, or DVP, in case we say that acronym for people that don't know. So tell us, I guess we should probably start off with, let's talk about what domestic violence is before we talk about the programs. So what is domestic violence?
So domestic violence, how I would define it, is a pattern of behaviors that's meant to control, intimidate, or coerce someone. And it ranges and takes in many forms and affects many people. So it's not just physical violence. We see things with emotional abuse, psychological abuse, social violence, and financial abuse. There's various caveats that we can go into with it, but with domestic violence, as I mentioned, it affects a wide range of people regardless of identity, gender, ethnicity, and really just the heart of it is just that control piece. Someone wanting to control another individual and really limit their freedom, whether their independence, and in a sense also not respecting them for being their own individual person. And so really with the domestic violence prevention program, we really just want to offer support to those individuals and help them build towards holistic health and well-being, whether that's, having accesses to resources like housing and legal assistance, or getting them connected with, social support and having them build a sense of community if they're in Phoenix or in other areas of Maricopa County.
Okay, so I want to just reiterate, it's not, or just ask you again.
Yeah.
So it's not just for women.
Yes.
And domestic violence doesn't pertain just to women or girls or young or teens, right? It's anybody.
Yes.
And it can be any age.
Yes.
Any gender and any ethnicity.
Yes.
Because I think sometimes people think, oh, well, it's just for women and, it's just whatever.
Right.
Okay, so it's really anybody that's trying to gain control.
Yes.
Okay. So I know October's Domestic Violence Awareness Month, and I know that's when, it's like the color purple and lots of things, and I know there's light up, I think the state capitol is light up purple and different things like that. So you've got, in terms of the domestic violence program at Native Health, what program or what do you do? So can anybody who's experienced domestic violence call you? Or do they come see you? Do they make an appointment? Do they walk in? And how does that work?
So that's yes to everything.
Okay.
With the domestic violence program, we want to make sure that we're providing support to all individuals who are experiencing some type of abuse or violence in their home or in their own life. And so with that, There are services that we, do mobile advocacy. So maybe folks, most often it's folks coming into Native Health, disclosing an experience of violence or that, they're needing service for that. We can meet them there. But if they call, Native Health and share that, I would like to set up something, we can do telehealth, and we can also meet them. Let's say like they don't have transportation to get to Native Health. I can travel over and meet with them, talk about services and what other ways that we can support them. And with the program, we kind of range from case management to prevention to response. So we're kind of just everywhere in between where that individual may need support. So we do offer prevention education like healthy relationship, healthy communication. We're hoping to expand a bit more into bystander intervention and kind of getting a bit more involved with youth. But in terms of like response and support, case management, we do safety planning, referral to local services in Maricopa County, get them assistance with legal and also emotional support, whether it's, helping and attending court hearings or getting them connected to domestic violence shelters and offering a form of transportation to them.
Okay, so I want to back up. First, you said like you can meet people. I know that we also have Uber Health here.
Yeah.
Are we able to like Uber if somebody were to call you? You could either meet them or we could Uber them over?
Yes.
Okay. Now, is this only for American Indians or is this for anybody? I don't know which grant you've got or what you're covered under. And so just American Indians or anybody?
So most of the services that we offer are towards American Indians.
Okay.
Really, it's just anyone who's enrolled in Native Health where we can offer these services. If they're not enrolled, I can help them get set up and meet with someone to get enrolled through Access or whatever form of insurance. But really, it's just open to anyone in that moment of crisis. And if I'm not able to assist them in that moment, I can get them referred out to someone that, has the ability and capacity to assist them.
Okay. And how about ages? Can minors appear or is it for like 13 and up?
Yeah, that's a great question. Really, it's only 13 and up. If it's anyone under the age of 13, I would have to refer them out to someone that's a bit more specialized for the youth.
Okay. And males and females?
Yes.
Okay, 13 and over. All right. So let's go back and talk about some of the different forms that domestic violence can take. I know, obviously, there's the sexual, so sexual assault, or would it even need to be a sexual assault? Could it be, I don't even know, intimidation or pressure?
Yeah, most definitely.
Something like that?
Yeah, so with domestic violence, as I mentioned, it takes many forms. I feel like a lot of folks mostly mention physical violence and sexual abuse, and those are obviously very serious and have have significant impact on the survivor. Other forms include like financial abuse, where you may limit or restrict access to resources, to money, which can make it difficult for that individual to make independent choices or to even leave an unsafe situation. We have spiritual abuse, where someone may belittle or criticize their religion, religious practices, ceremonial practices, and so that could also look like preventing someone from going home back to the reservation to attend a ceremony or to meet with family for a ceremonial practice. There's also social abuse or social violence, where really it's just socially isolating that individual from friends and family, close loved ones, peers at school. Working on a college campus, a lot of times we saw academic abuse, which I feel like is a term that's not often talked about.
I've not heard that. And what is that?
So that's kind of like when folks are in a relationship, someone may tear up textbooks or prevent them from attending class to where they are not able to maintain or to, promote their own intellectual health. And so unfortunately, we saw that a lot with college students. So getting them access to, new textbooks, new resources, access to a new laptop.
Does that happen very often?
Surprisingly, yeah.
Like, what would be the reason?
Like
just so that they're not successful in school and that they're dependent on them?
That, and also sometimes in a fit of rage, they may throw things away. Maybe not to explicitly do that for that reason, but they're it was just in a fit of rage and they just wanted to destroy something. It just so happened to be a textbook. But
I'm thinking a laptop. If you destroy somebody's laptop, that's a big deal.
Most definitely.
They're expensive and all of your works on it and probably not backed up, or maybe, but.
So there's definitely, there's a lot of different forms of domestic violence. And most often, like, we hear like psychological violence. So that could look like intimidating or belittling someone, constantly criticizing them or putting them down to feel bad. It could also look like consistently creating an environment where they feel unsafe or not wanted, in a sense. Like, they don't feel supported in that relationship. So kind of in a sense, like, I'm trying to think of the right word for this. Like, if someone were to, maybe they were calling out a behavior, someone may, change the narrative or the script of that situation in some way, gaslighting. That's another form of psychological abuse.
Okay. All right. So if somebody's in a relationship, what would be a tip-off that it might not be the best relationship? It might be unhealthy or unsafe. What if somebody's looking at your social media or taking your phone?
Right.
Or, like, I don't know, would that be the first thing?
So it definitely depends on the situation and, like, those individuals. But most often, the warning signs of a relationship that's unhealthy or abusive, again, it often shows in patterns of control and intimidation. So, as you mentioned, maybe consistently checking someone's phone, surveillancing them, tracking their location on the iPhone maps.
On the apps.
Yeah. It could also look like, again, like controlling behavior, isolating them, maybe consistent jealousy, not letting them, go out with friends and family or to a study session with friends. It could also look like, for that individual who may be experiencing abuse, fear of speaking of their situation, fear of maybe interacting with another individual, in fear of retaliation or judgment from their spouse or whoever it may be. And so I think these behaviors may seem small from an outside perspective, but over time, like, they can accumulate and have, detrimental impact on that person's well-being and overall health. And so as a community member, it's really important for us to increase our own awareness of what domestic violence can look like, and again, broaden it. So it's not just focused on physical violence and sexual violence, including like psychological abuse, financial abuse, spiritual abuse, and so on, so that we know what those signs are. And if we see that in our community, with friends, with close loved ones, that we, are able to find it, identify it, and, maybe take a chance to say, hey, like, I noticed this. Are you doing okay? Can I help you? Is there anything that I can do? I'm a little worried about you, to, show that, they support them and that they're not alone in their situation.
Well, and one thing that we really haven't talked about is, you talked about teen dating violence. Domestic violence.
Yeah.
And I think back, whether like middle school,
right,
they're just getting started and just learning, and how do you know that behavior is not okay?
Right.
Like, and who do you tell? Do you tell your parents? But that might be a little scary.
Right.
You tell somebody at school. Do they come here? I mean, what would be a tip off for somebody in either middle school or high school? Like, you're a young woman just starting to date or interested, and how do you know, if they're taking your phone or they're pinching you, or I don't know, what would be some signs, and what should you do?
Yeah, that's actually a really good question. I love working with the youth and, kind of engaging and talking about healthy relationship and healthy communication, because I feel like the younger we start, I feel like, again, like, the youth is our future. The youth is, if we are able to teach them what healthy relationships are, what are those components, things like that, we can hopefully create a new generation of people to be able to, readily be available to recognize these warning signs. Right.
I mean, like middle schooler and high schoolers, we want them to be healthy and know, like, that's not okay.
Exactly.
It is not okay that your friend or the person that you're with is taking your phone and looking where you are and harassing you.
Most definitely. And so I think with, like, kind of getting back to the question you asked with them recognizing that, a lot of times, like, I always mention with the youth, healthy relationships are based on respect and equality. Those are some of the two biggest components for them to look out at or look for in whatever relationship that they have. So if they feel at any sense they're disrespected or they're not treated as an equal, red flags. And if they, notice other signs of, them pushing off, those behaviors as, I'm joking, and they're invalidating their experiences, then they know that that individual isn't trusted, or that, I have some red flags and maybe I might need to distance myself from them. But again, that kind of goes back to like that community awareness piece. If we have, our parents and caregivers trained in like those things, teaching their children and the youth about, these warning signs of unhealthy and healthy relationships, kind of getting the ball rolling and beginning a larger conversation of what are other things that we can talk about in terms of domestic violence prevention.
So how early should you talk to your child? I mean, it's like, do you talk to them when they're like 10 or 12?
So for me, like personally, like growing up in my own home, my mom started off really early. So I come from a family that has domestic violence in multiple generations. And so growing up, like my grandparents always told me no one should ever lay a hand on you, and you should never lay a hand on someone else. You shouldn't be, involved or get in someone's space if they don't want that. And being able to read cues of, this person doesn't feel comfortable with this, or being mindful and respectful of another person's space and belongings, and how they feel, and protecting their own autonomy. So I think beginning that conversation with boundaries is a great first start with like children, toddlers, telling them like, there's a whole discourse on like social media of like, no, I'm not going to share my food with you because you have your own food. So yeah, like even like that is like a great start in like, talking about healthy communication and healthy relationships. I'm not a mom, so I can't really I don't know the nitty gritty of everything, but
no, I mean, I've heard that, and I've heard that like, as a toddler or preschooler saying like, you don't want to kiss grandpa, you don't have to kiss grandpa,
right.
Rather than saying, oh, go kiss grandpa or grandma and get a hug, and like
right.
If you don't want to, just saying no. One thing we also didn't talk about was clothing. So I know that there's like a lot of discussion. Is it okay if you're in, let's just say middle school, high school, or whatever, for somebody to say, no, you can't wear that, or that's too sexy, or not? I mean, I don't know if that's ever a discussion with any of that. Is that part of it? Is that should somebody be able to control what you wear? I don't know.
Yeah, that's definitely a tricky question. I believe personally, anyone can wear what they want. Obviously, that's up to the discretion of the parents and caregivers of that situation. But that's also not a reason why someone should experience any type of violence in their lifetime based on what they wear or what they share or what they believe in.
There was was it the Jean Day?
Oh, yeah.
What is that one?
Denim Day.
Denim Day.
Yes.
That's right.
Yes.
And I know that was for an honor or recognition, recognition of people, right? That was that a court case?
Yes, it was a national court case in Italy. Denim Day is really just a day of acknowledging that you should be believing survivors regardless of what they're wearing or what other people may say about that situation. It's a bit more nuanced.
So, Brooke, in terms of Denim Day, I know like a few years ago we did a Denim Day here, and I don't remember a lot of it, but I do know that people came in and decorated like denim squares, and that nobody should have any sexual assault or domestic violence around what they're wearing.
Right.
And I can't remember, is Denim Day in October or no?
Denim Day actually takes place in April for Sexual Assault Awareness Month. But I think there's a lot of components from Denim Day that we can bring into domestic violence, especially getting into like that sexual abuse component of domestic violence. Working on a college campus and, being at NAU, we did a lot of collaboration for Denim Day. So I worked with a lot of sororities, raising awareness about this and how like your item of clothing, whatever you wore in any situation, should never be
right? An invitation for domestic violence or sexual assault,
exactly.
Right? Wasn't that was the court case?
Yes.
Like that somebody had said like she wore tight jeans and that's why she
she
deserved it or something, right?
Yeah,
was that it?
So the court case was the judge and like the prosecutor said that the jeans were too tight, so it required two hands to unbutton and to take off. So as a result, that indicated consent because it required two hands.
We'll continue our interview with Brooke Davis after this short break. Support for KRDP 90.7 FM comes in part from Native Health, with 2 locations in Phoenix, 4041 North Central Avenue, Building C, near the corner of Central Avenue and Indian School Road, and at 8800 North 22nd Avenue. Native Health is also located in Mesa at 777 West Southern Avenue, near the corner of Southern Avenue and Extension Road. Native Health provides primary medical, dental, behavioral health, WIC, and wellness services for the urban Native American community. For more information, call 602-279-5262 or visit our webpage at nativehealthphoenix.org. Native Talk Arizona returns after this song. You are listening to Remember Me by Fawn Wood, featuring Randy Wood and Carlos Nakai.
Hey yo, hey, hey, be a way, oh, hey yo, hey, be a way, oh, hey yo, hey yo, Remember me, when the sun comes up in the morning sky. There I will be, soaring with the eagle so high, feeling free. Remember me, down the road, hand in hand, you and me. Hello, hey, hey, be a way, oh, hey, hey, be a way, oh, hey,
Okay, so after talking about Denim Day, one thing that we haven't talked about is also older people. You know, not everybody that's affected by domestic violence and sexual assault is like in their 10s, 20s, and 30s. Or
Right.
not 10s, but, you know, teens, 20s, and 30s. It can happen to older people as well.
Right.
I know there have been some cases recently in the Valley and you know, just horrific things to older women. So it can be any age, any person, right?
Yes.
Okay. All right. So one thing that we haven't talked about are statistics. And I know statistics within the American Indian community are absolutely horrible, horrific, the worst, I believe the worst statistics, correct?
Yes.
Out of any group?
Yes.
Okay. So can you tell me some of, sorry, putting you on the spot, what are some of those statistics?
So right now I only mostly have statistics on the national level. So 1 in 4 women, 1 in 7 men have experienced a severe form of physical violence from an intimate partner
Is
in
that
their lifetime.
general population?
Yes.
So 1 in 4 women
And 1 in 7 men.
and 1 in 7 men. So staggering statistics. One, that's shocking to me.
Right.
That you're in a room with 4 people and one woman has experienced that. And also kind of surprising, 1 in 7
Yes.
as well.
And I think with national statistics, I also would like to give some leeway or like context that these numbers that are reported on a national survey or a national level, I believe are lower than what's actually occurring in the community. There's a lot of barriers and perceived barriers to reporting. For example, with men, that's a lot lower than women. And I think a lot of times, we kind of talked about this a bit earlier, but there is a term called atypical survivor, and that typically refers to individuals who do not meet the socially defined characteristics of what a survivor may be. As we know, domestic and sexual violence affects everyone regardless of age, gender, and various backgrounds and identities. And so some folks sometimes in mainstream media, the ways that, you know, may be portrayed in TV, movies, in the way that, how often it's reported or believed by law enforcement. Some folks may experience additional hurdles in receiving care, reporting their incidences to police officers, to law enforcement, and getting, access to local support services. And typically, atypical survivors include men, the elderly, sometimes the youth, people with disabilities, and those that are in same-sex marriages or relationships.
Nobody should have to experience domestic violence, sexual assault. I mean, just no one.
Right.
All right. So let's talk a little bit about the American Indian statistics, which I know are worse. I believe they're the worst, right? Out of any population?
Yes, out of all ethnicities, according to the CDC. I know that for female or for women who are Native American, homicide is the third leading cause of death for those women, in comparison to other types or forms of mortality. So comorbidities like type 2 diabetes, hypertension, any other types of heart diseases, which is quite alarming because for other ethnicities, those preventative or chronic diseases are typically the top 5 and top 10, but homicide is the third leading cause for Native women.
That's just awful.
Right.
And then I know that the statistic with sexual violence or domestic violence or sexual assault is really high as well, right? Isn't it like 1 in 3 or something?
Yes, 1 in 3 women have experienced sexual violence in their lifetime. And for men, I believe it's 1 in 5.
That's just unbelievable.
Mm-hmm.
And do you think those numbers are accurate?
I do not. I know for tribal communities, it can be a little difficult either doing reporting, especially if they live in a tribal community that may have limited resources with law enforcement for advocate, victim witness services, and so on. So getting those services in order to report may be a barrier. Additionally, there's also social barriers. So maybe it's someone in their community and they feel that they wouldn't be believed by their community if they were to, disclose their experiences to a family or to a friend, and, maybe experience retaliation for reporting their incident. And so I do believe that these numbers are drastically underreported, and I think that it's something that a conversation that we should be having in hopes of again increasing awareness to prevent, but also to ensure that our community, we believe survivors so that they feel comfortable and empowered to come forward with their stories and getting the justice that they deserve and need in their healing journey.
Why do you think it's so high?
I mean
that's just 1 in 3 is crazy, and you feel like it's underreported. So if you think that, maybe it's 1 in 2. But why is that? Is it generation? Is it cycles of generations experiencing this? And I know you mentioned you had a history of that in your family,
right?
Do you think that's it? Do you think it's? I don't know. What's your thought?
Yeah, I definitely think it's a combination of multiple things. Definitely cycles of violence in a household. It's intergenerational trauma. Sometimes as we know, Indigenous people on Turtle Island or in the United States and elsewhere have a lot of historical trauma with the government, with local authorities, and that also creates another barrier for accessing services they have their own history with IHS, with their own medical services. So not feeling comfortable enough to go see a nurse at IHS due to historical trauma, maybe from family or from their own tribe. There's also limitations with, maybe they don't feel supported by their own police officers in order to report those services. But I think in terms of why these numbers are so high, honestly, sometimes it might just be, I guess in terms of it can be issues with education and awareness of what domestic and sexual violence is. Oftentimes the surveys, when they ask these questions, it's a lot more explicit. So then when they are, kind of thinking back on their experiences and, being asked that question, they're able to identify that behavior as domestic violence or sexual violence. So that increases awareness in that situation or in that moment. But Additionally, in terms of the cycles of violence in a community, if we're not holding, the individuals, maybe a family member or a friend or some loved one in our community accountable, it increases that cycle of violence to continue. So, and there's a lot of caveats to that.
Do you think are the numbers higher on the reservations versus like in the city or urban areas? Or do they not look at that? The statistics, is it just looking at American Indian statistics, or are they looking at different settings?
So they're not there's not really a comparison between the two, but I can imagine that it may be a bit higher in urban communities, just with the larger population size. But I can't.
And underreporting.
Yeah.
And people afraid of not knowing how to access.
Yeah.
How and where to access services and
Exactly.
support. Okay. So if somebody is uncomfortable, like you've got somebody who's uncomfortable, they feel unsafe, they're thinking about leaving a relationship. Do you think about it, or do you just do it, or do they call you? Like, what would the step be? And I know there's some resources online, and I know there's ways that, like, if you're looking at stuff that you can hit an escape button.
Yeah.
But so what would you do? What's the first step or steps?
Yeah, I think if someone is feeling unsafe or thinking about leaving an abusive relationship or an environment that has domestic violence, I think it's important to approach that situation with support and really prioritizing their own safety and well-being in that situation. Safety planning, I think, could be a really helpful step. So, sitting down maybe with an advocate to think about, practical ways to stay safe while, being mindful of what choices you have, what is your current capacity, and what next step do you think will make you feel the safest?
Well, I think it's hard. I mean, if you're a mom with a child or a dad with a child and you're being abused, first of all, you've got to think, okay, is it safe to leave for safety planning?
Right.
How do I do that? How do I make sure I'm not going to get caught and get caught up in violence? And then you're talking about, when we're talking about like the cycle of violence, then you've got children watching.
Right.
And, if somebody's getting hit or when somebody's drinking or using substances or whatever the situation, one, it's generational violence, they're watching it, but then how do you get them out safely? And I know I've seen that happen, and people are terrified. And, safety planning and who do you trust, and
right.
I think there's a lot that goes into it. It's a lot to think about and overwhelming. And, I know there have been cases where people have basically been held captive in their house.
Right. And
or wherever.
Yeah, most definitely. And I think I kind of like to go back to the safety planning piece because, again, that's an opportunity to meet with an advocate or whoever in the community to kind of sit and identify trusted people to reach out to.
First of all, let's talk about trusted people.
Right.
Like, who's a trusted person? And how do you know that they're not going to say anything? Like, how do you do that?
Yeah, to me, I would identify or define a trusted person as someone who is there, that listens to you, that believes you, that supports you without judgment and prioritizes your own space and, your own stories, and acknowledges that, the stories that you share, they can't share on behalf of you. And they're being respectful of that throughout whatever form of communication and ways that you show trust in that relationship. But with that, it can be a little intimidating to identify and name a trusted person, especially if you've experienced trauma or abuse. And I think for most folks in a community, they would say that a trusted person may be a family member, a friend, a counselor, or maybe a community member that they're really close to.
I think it's hard, though. I think some people, you hope you can trust them.
Right.
But also, if you, does this person even let you go meet them?
Right.
And then how do you get a word in, and how do you tell them? And then how do you contact them if you really need help? If you're going shopping with somebody or out to lunch and then you don't get to see them, how do you say, I'm being abused and I need out, or when I contact you, I need to get out?
Right.
And somebody's watching your phone and watching all your stuff.
Most definitely.
That's a hard... how do you do that?
So with that person, first it's just obviously finding that person, right? Finding someone that you can trust. And some folks, again, don't have that. So if they don't, I would recommend, maybe seeking out programs or support groups, just so that you can find someone to speak to, whether, it's a healthcare provider, your counselor or maybe just someone in your own community, whether it's someone that you attend social groups with or a family member or friend.
Or clergy, I guess it could be.
Yes.
Also in the church or whatever. I know that like here, I know I've seen that like people will come for appointments and then like they can be here for a medical or dental appointment.
Yeah.
And then they can also ask to see you.
Yeah.
And so so that person's not just saying, hey, I'm going in to see a domestic violence program person,
Right.
but I'm actually there for a medical appointment. And things like that.
Yeah. And I think like also getting back to that piece of like, if they're being surveillance and if they have limitations to even contacting someone, know that, there are emergency hotlines available. If they have a phone to call, that's an option. There's also like the websites where they can speak with someone or text someone separately. But again, if there's like surveillance issues, know that, there are mandated reporters in the community. So for example, Native Health, I believe everyone in the facility are mandated reporters. So if you come in disclosing, someone will be there to help you and, kind of navigate the next steps with you.
But it's scary.
Right.
And if you're not ready to take that next step,
Right.
like if you need to get out, but you're not, you don't have the financial means, you don't have housing set up, you don't have an escape plan.
Right.
I know there have been some horrific things that I've seen here and heard where people, definitely being locked in and all kinds of things happening. So let's talk about, I know that you were up at NAU and different communities, but let's talk about like the Valley for our listeners that are down here. I know there are some resources specific, and I'm assuming it's everywhere. So there are domestic violence or sexual assault facilities or shelters and things like that. And I know that you can go into those, and those addresses, those people are kept safe, whether they're males or females or families, correct?
Yes.
And I'm assuming that's also in tribal communities. Is that?
Most definitely.
Okay.
So like specifically in Maricopa, most often, as a case manager, I typically refer people out to those services if those individuals don't know where to start, or maybe they're intimidated to begin the process of calling a domestic violence shelter or an advocate that specializes in that to get not guarantee, but to prioritize their safety and like getting out in that moment. So emergency shelters really. So like for example, like in the Maricopa County, there's the Arizona Coalition to End Sexual and Domestic Violence, ACES DV, that has a whole wide range of resources and connections throughout the state of Arizona to get them serviced and to get people
Into
support that
shelters,
they need.
into safe shelters?
Yes. And then there's also the Southwest Indian Women's Coalition that helps with that. There's Native Strong Heartline or Heartbeat. Heartline.
Whatever it used to be.
Yeah.
It used to be Heartline. I don't know if it still is.
Yeah. So there's that one too where, they can get people resources in tribal communities that are specifically for Native populations.
All right, let's talk about trafficking because we haven't touched on that at all and we don't have a ton of time left. Is trafficking a form of sexual assault or domestic violence?
Yes.
And, I know we've been talking about the sober living crisis.
Yeah.
And missing and murdered Indigenous peoples, MLIP. But I'm thinking more like right now, the trafficking, when you've got somebody who is actively trafficking another person for financial benefit, right? So in that case, what would you do? Would that be, I don't even know if you're dating somebody or you're coming across and they're trafficking you, would you notify the authorities? Like, do you handle that? Like, tell me more about that.
Yeah. So if those folks were to come into Native Health and, share and express concerns about like financial exploitation or labor exploitation and indicating.
Well, you say it so much more eloquently than I do.
Like that
Yes.
that may indicate human trafficking. I unfortunately, in the state of Arizona, there are some barriers at times to accessing services for survivors and victims of human trafficking. So my first step is notifying a hotline because they have their own separate step where they have to get screened and, be, enrolled into services to receive support and services for human trafficking. And so there is Arizona has their own separate hotline for human trafficking. And surprisingly, Arizona is actually the first state in all of the United States to have a human trafficking hotline.
I would assume we also have a pretty high incidents of trafficking.
Yes.
I mean, like really high. Are we at the top? Probably.
We're like in the top 10. Of
course.
And it's actually much higher in northern Arizona, like the rates of human trafficking. But there are procedures set in place for all shelters and all advocates that are involved in this concern to follow to ensure that, it's consistent, it's streamlined for those individuals that are seeking the services.
So if somebody is being trafficked or think they're being trafficked or drugged or whatever's going on, how do they find that phone number? Is there like a way, do you just Google it and just say like victim of human trafficking in Arizona or?
Yes. So there is a national hotline. If they just look up Arizona human trafficking hotline, that the first number will pop up. But worst case scenario, if they don't have access to to Google that question or to Google that program, they can come into the police department, they can come into a medical facility, they can come into Native Health, whatever it might be, and those individuals will have a toolkit to follow to ensure that they get to those individuals.
Because I know I'm thinking like airports, in the inside of the bathroom stalls, there's always something like, there's always the images and the text. I don't know if it's in all bathrooms, but the ones I've been in, that's what I see.
Yeah.
Okay. So if somebody is, let's go back to domestic violence and sexual assault because we only have a couple minutes left. So if somebody is being abused, what advice, like quickly, would you have? Like, would it be think about it when you're talking to your medical provider or friend? Think about getting help. Think about how you want to get out. Would that be a fairly quick answer and tip, or what would you suggest?
I think for survivors of domestic violence, sexual violence, or even human trafficking, I would just like to first start off with saying that they're not alone, and that, the abuse is never their fault. And reaching out, whether to a trusted friend, a counselor, or maybe even a support program, is a really courageous first step, and that healing takes time, and with that, it's okay to move at your own pace. So if you're not ready to take that next step of reporting it to police or leaving that situation, take it little by little, whether it's doing safety planning, meeting with an advocate to talk about what are some other options that I can follow or do to get out of a situation. Also, just practice self-care and acknowledge that every step you take towards safety and support matters to you, to your community, to your family, and that there are services here that want to support and that believe you in your that want to support you in your healing journey.
And I think a lot of it, what you just said, I think is really important. Like, I believe you.
Yes.
I believe you and I support you. But I believe your story and I believe what you're telling me.
Exactly. And I think some other advice I have for loved ones who, want to help someone who's experiencing domestic violence or sexual violence, that their role is really to listen, to believe, and support survivors without judgment. They can offer help by connecting to resources or, creating a safe space for them and really just respecting their choices. For those individuals that, have experienced the abuse and trauma, they've already gone through, they've already lost that sense of choice, that sense of independence and autonomy. So really just letting them be their own driver in their own car on their own healing journey, going whatever pace that they need to feel comfortable and to, manage their healing.
Boy, you describe it so well and so easily. All right. Well, we're pretty much out of time. So where can our listeners go for more information or help if they're experiencing abuse or if they're worried about somebody they care about? Would it just, again, I know you've mentioned the hotlines and things like that, but if they're in Phoenix or Maricopa County and they want to talk to you, let's talk about that. Everybody else, you could go to the hotlines that were mentioned, which is Native Helplines, I believe. I think it's Native Helplines. We'll have to put that in the caption. But if they're at Native Health or they're in Maricopa County and then or not, and they want to talk to you, how would they reach you?
Yeah. So for anyone who's interested in seeking services or wanting to meet with me, I'm happy to give out my phone number and also my email. It's probably better with email though. You can reach me at bdavis@nachci.com. And then if you're interested in seeking services at Native Health, you can come in, book an appointment with me by calling the Native Health phone number
602-279-5262. But can they walk in? So if somebody has an emergency or they're being abused or whatever and they've just about had it, they can walk in, right? And ask for you?
100%.
Okay.
100%.
And they can also call and say, hey, you know what? I just abuse or whatever. And they can get to you just
Yes.
for asking Brooke. I know we have a couple Brooks, so ask for Brooke Davis.
Yes.
All right. I really appreciate your time. I think October Domestic Violence Awareness Month is super important, and you can never bring enough awareness. But I think the tip that I learned the most today from you is, one, believe and support. But I think also teach your young children that it's okay to say no, that if they don't want to hug or they don't want to give grandpa a kiss, it's okay. And that's, I guess, how you learn at a young age and to reach out to you, right?
Yeah, and with that also, everyone in our community has a role to play in addressing domestic and sexual violence.
Thanks for coming on. I appreciate it.
Wonderful to be here.
Thank you for listening to Native Talk Arizona, presented by Native Health and 90.7 FM KRDP. Our executive producer is Susan Levy. Sound engineer is Javier Quiroga. We hope you will tune in again next week. If you have any questions, please reach us at nativetalkaz@listentoKRDP.com.